Good morning. My name is Gayl McKinley. I'm from Ottawa and I have coronary artery disease. I'm here today to talk to you as a woman with lived experience, a woman with heart disease. And for me, part of that lived experience has been figuring out what my new normal is. And spoiler alert, it's definitely a journey, not a destination. Also, learning about how women's hearts are different than men's, learning to live with taking a lot of medications and how to manage the side effects, learning how to be my own best advocate, whether it's setting boundaries or asking for help, and learning to accept my limitations and learning just how much I still can do. I'm a peer support leader for the Women at Heart peer support program offered by the Canadian Women's Heart Health Centre, part of the University of Ottawa Heart Institute, a center dedicated exclusively to conducting women-specific heart and vascular health research, as well as delivering local and national initiatives aimed at improving outcomes for women who are at risk of or living with heart disease. And here's some of the key points that I'll be covering today in this video. First, I'll be sharing with you my personal heart journey that started 8 years ago. Next, I am so passionate about sharing what I've learned about women's hearts, about the disparities we endure because most of the heart research historically has been done using men, and which means women and a lot of healthcare professionals and the general public have little to no idea of what heart symptoms look like for a woman. And we can change that. Knowledge is power. The more we know, the more we can share. And the more lives of women, our friends, our sisters, our daughters, our mothers, we may change. We can save women's lives with this knowledge. So I'm going to be talking about women's hearts and what makes us different. And I would love for you, after watching this video today, just to talk to one other woman about just something that you've learned, even just one thing. Go ahead, tell them everything, but at least one thing, because you never know whose life you may change. The other area I'm going to talk with you about is the journey to find your new normal after a heart event. The Women at Heart peer support program is very much geared towards helping women discover their new normal after a heart event. I'll be sharing some key areas from our program that I have found resonates the most with women in my groups when they join us right after cardiac rehab. First, there's a little housekeeping to take care of. And in a nutshell, please don't sue the Ottawa Heart Institute. Also, don't sue me. I have a lot of opinions, but they're just that, opinions. They're not medical advice or even a substitute for qualified medical professional help. Always, always check with your healthcare professional if you have any questions regarding your medical care. My heart journey started when I was diagnosed in November 2015 after what I now realize is a series of very fortuitous events. I'd been having problems with a knee replacement and I was given back-to-back cortisone shots, with the second one making me feel just off. And I had trouble sleeping for days. I was on vacation, and every time I would wake up at night, just unsettled, uncomfortable. And as soon as I would sit up in bed, I was exhausted and I would nod off. And if I would lay down, same thing, just couldn't do it. And this went on for several days. So it was just enough for me to go, something's not right here. And I'm going to go talk to my doctor when I get back, because I just think this is something that he should note, that don't ever give me cortisone again. This was not fun. So the doctor listened to me with my uncomfortable feeling. That was my only symptom, just an uncomfortable feeling. He asked me about my family history. He asked really good questions and he listened. After some blood work was done, he said that with my elevated cholesterol and my family history, he wanted me to have a stress test, which I had a month later and which I failed. And my heart journey really started. Oh, and Even though I failed my stress test, I was told at the clinic, oh, don't be too worried about that. This test was made for men, and women have a 30% false positive. I was shocked at that. And that's where my women's heart journey started. I was referred to a cardiologist who sent me for a CT scan where they discovered I had a serious blockage at the very top of my left artery, a widowmaker. The same thing my father ultimately died from at age 62. The next step was an angiogram a few weeks later, with me thinking, okay, so they'll fix the blockage with a stent and everything will be fine. I'll just walk out and my life will just continue on. No biggie, because that's what Google told me was going to happen. And so I was very confused when I was rolled out of the treatment room without a stent. The cardiac surgeon told me they didn't want to put a stent in because of where my blockage was, and that because I had several blockages also on my right side, he felt a triple bypass at my, quote, young age was the best solution. Not being a critical case, my surgery could wait, and it would be about 3 months. So don't do anything stressful, no going to the gym, just continue your life, and we'll see you in 3 months. In hindsight, those months affected me more than I realized. I did contract work as a website consultant, and it was stressful with long hours. Yet I still seem to have a lot of time to catastrophize my situation. Would I wake up in the morning? What was that weird pain in my chest? Is this it? And so on, as my anxiety spiraled. I knew of no one with heart issues that I could talk with about this. My triple bypass surgery finally occurred in March 2016. I physically recovered very well after my surgery, and 8 weeks later, off I went to rehab. At rehab, I was the only woman there for the first week. And that was kind of lonely because the men would come in and kind of grunt and say good morning, and off they would do their stuff. And then another grunt, good night, goodbye, and off they would go. So it wasn't the most fun experience. But then the second week, another woman showed up, and I was so excited. And we would spend our warm up walk talking to each other about our journey, our frustrations, our unanswered health questions, and all of the things that I'm sure many of you can relate to. And pretty quickly, we were showing up 15 minutes early just because we didn't have enough time in our warm up time to be able to talk. We needed a lot more to be able to just walk for 15 minutes and see how everybody was doing. And then another woman showed up, and it was 3 of us walking around, talking and sharing. It just felt so good to be able to talk with someone who really understood what I was going through. At the end of rehab, all the medical professionals told me I was doing great. Just get back out there and have a great life. Okay. So off I went, all fixed, back to my work and my life. And I tried. I really tried. And I really struggled for quite some time with trying to maintain my old life when, in actual fact, everything had changed. I didn't feel connected the same way to my friends, my family, my career. I just felt adrift, and it was really confusing. I eventually reached out for some help with my mental health. I realized I needed to retire from the stress of my work. And then I pondered, well, now what? I'm still pretty young, got a few good years ahead of me. What am I going to do now? And for me, a big part of my what came from the Canadian Women's Heart Health Center. Leaving rehab one day, I'd noticed the Canadian Women's Heart Health Center was just down the hallway. And knowing how much it had helped me to talk with other women during rehab, I'd gone in to see how I could volunteer. They told me about their Women at Heart peer support program and asked if I would consider being a peer support leader. It was really scary for me, but saying yes is one of the best decisions I've ever made. I've now been leading the Women at Heart peer support program groups of women for almost 6 years. And I get so excited with every group that I get to share information with about how women's hearts are different. And I have the privilege of watching my group start to navigate their own new normal journey and become empowered by the knowledge they learn.